In the previous clip, I talked about the surgery to remove the testicles, which is called orchidectomy, and I ended by mentioning that it is different from castration in eunuchs of the past. In fact, there were two types of castration techniques. The first one is called castration, which means removing both the testicles and the penis. The second type is called nullification, which means removing everything, the penis, the testicles, and the scrotal sac, so that after surgery, the area looks flat and smooth, as if there had never been any male genital at all. From historical records in China during the Ming and Qing dynasty, there was a term recorded as 全割, which literally means cut off everything. This term makes us believe that most eunuchs in the past underwent complete removal. The specialists who performed the nullification would use a sharp knife to cut everything off in a single stroke with no anesthesia and no pain relief at all. Those who were castrated was often boys younger than 10 years old who had been sold to serve the palace. After nullification, some children from infection or excessive blood loss. Those who survived had to suffer from lifelong difficulty urinating because the urethral opening would shrink to the size of a tiny pinhole. Each time they urinated, they had to push very hard or press on their lower abdomen just to make the urine flow out. If we compare the castration of eunuchs with modern gender-affirming surgery, I would say they are completely different. Although both procedures involve removal of male genitalia, the purpose is entirely different. Let me summarize the comparison clearly. First, in terms of purpose, castration was done to eliminate male sexuality so that eunuchs wouldn't have sexual desire and wouldn't get involved with the palace women. But modern gender-affirming surgery is done so that patients can gain their true gender identity. Second, in terms of consent, eunuchs were forced to undergo castration, while gender-affirming patients choose to have surgery voluntarily and even get to choose the type of vagina they prefer. Third, in terms of psychological impact, eunuchs lost their gender and dignity, but transgender individuals gained their true self and confidence back. Fourth, in terms of medical outcome, eunuchs lost their genitals and suffer from lifelong urination problems. Meanwhile, transgender patients receive a beautiful new vagina that functions well and they can still experience sexual pleasure. Now we at the end of this clip. You may be wondering, today are there still people who want to undergo nullification? The answer is yes, although it's a small group. Some individuals feel that they do not want to have any genitalia at all, not because they're being forced like in the past, but because it is their personal decision to align with their gender identity and how they truly feel inside. And today, with advanced techniques, experienced surgeons can now design the urethral opening in a way that's safe and prevent any narrowing. Thank you for watching. See you again in the next clip.